So, okay, so we're recording and I'm here again. I think we're what, 4 months later now from the first time I spoke here. And it felt like it was time for an update. And I sent out an email today you may have gotten, and I'm going to try and share that screen so that you can see a little bit about what I'm talking about. But it's been, I think we talked in March, we had very few cases, maybe less than 100 in Arizona, if you can remember that time in March. And we went on lockdown soon afterwards. And we were on lockdown, I guess, for a month. It was hard to tell. And by the middle of May, all the restrictions were lifted. And our cases never stopped rising. We were supposed to wait till we flattened, and we didn't. And we just went back into business as usual. So I'm going to try and share my screen if you haven't already seen it. This is, okay. This is essentially a picture of what our map looked like here. So you can see, and I'm sorry I can't make this quite bigger with everything, but here we are in March. We have almost nothing, really less than 100 or so. April, we're in lockdown again, maybe a couple of hundred of new cases. And we entered May, and this is when our restrictions were lifted, right the middle of May completely. There was no more lockdown. There was no idea of essential workers. And you can see we're still rising here, but it doesn't look too bad in retrospect. And here in June, in case you haven't been watching this, we just went vertical. It was about a 900% rise from here up to our very peak, right around the 4th of July. And at some point, the governor began to get a little alarmed. The rest of the country was fairly alarmed. It seemed pretty normal here in Arizona, or for many of us, for most of us in Tucson, we were all living with this, with smoke. That was the view from my house when we got mandatory evacuation. And many of us went through that. So that was June. We were two hot spots and maybe distracted to realize how fast this curve went up. So I think it was about June 17th that we actually had a mandatory mask. And I think we all know there've been a lot of arguments about masks, but it became mandatory. And a week later, we actually reclosed the bars, the gyms, and gatherings over 50 people. And then you can see we're continuing to increase for about a week more. And then our curve just started going down, and it's continued going down. I think this cut off a week ago. I just checked again. We're still going down in terms of new cases. And that's called flattening the curve. And in fact, when I did this on Sunday, we were the only state that would consider where new cases are decreasing. So that's a really big thing to take in because we lived through all of this. I'm not sure how many people even knew it at the time or were too busy attending to the Bighorn fire. And this was actually on Sunday. And by today, several other states have joined us. Texas, which also had made masks mandatory and reclosed the bars and gyms. South Carolina, I'm not sure what they've done. Notable that's not in there is Florida. And again, making my same point, Florida, I believe, has kept their gyms open, at least in Miami. Someone I talked to yesterday said the gyms are still open and many people are not wearing masks at all. And they are not in flattening the curves. So this is where we've been, where we're through, and we're in a pretty good place now. I think today we have 170,000 cases total in Arizona. And that's actually 2.2% of our population has had a positive test. And what the CDC says is that you multiply by at least 10 for every counted case. So it's about 20% of our population in Arizona that is positive or has been positive for COVID, which is a fair amount. And then this statistic, not quite so happy, but again changing, is we were leading on Sunday at least in total cases of deaths, of new day deaths. I think Texas beat us yesterday. So This is what we call a lagging indicator. This is what happens. Deaths occur about 3 to 4 weeks afterwards, after the peak has stopped rising. So this is the COVID pandemic in Arizona, which I think is what most of us are concerned with. And I wanted to show that to everybody in case you're not following it. I use the New York Times. You can find other sites and monitor this and see how rapidly everything can change in a month, where we go from going up like this to being actually flat. And we are, when I look today, I think we have the second highest percentage of people who've tested positive for COVID in the US right now. So these are fairly astonishing statistics, yet I wanted to point out, and this is, I think, why I was asked to kind of share with everyone tonight briefly, is I have a pretty active caseload. I've only had one person test positive in Arizona for COVID. I've had nobody hospitalized anywhere and no deaths as far as I know. So that may just, I mean, when you look at how many people have had or have COVID in Arizona, to be able to say to you, in my case, my patients, nobody hospitalized, nobody dead, you have to realize there's a very big gap in people who are getting this and dying and people who I think are taking care of themselves in multiple ways. So I think that's really good news for everyone to hear. And I wanted to just share that. And other functional doctors will tell you similar stories, that even in New York at the height, it was similar. People who were running more integrated functional practices were not seeing the numbers that we see in the general population. And I just made some quick take-home points. I believe that masks and social distancing are effective in slowing transmission. And you're going to see an awful lot of chatter about why masks don't work, why we don't need to do this, why the deaths are not very high, et cetera. Is you might want to think about, these are the statistics in Arizona, and it would seem to me that masks and distancing stopped that really dramatic rise here. So I don't think there's really much explanation more why that happened. So continue doing reasonable things. And again, second point is, how dangerous is COVID for you? If you're a patient, you already take your health seriously. You've had mold illness. Most of you know how precious health is. You've been doing multiple things. You're not in bars, you know, not wearing masks, sharing drinks. I saw a GoFundMe on Facebook, I think, for someone who was trying to get funding and said, you know, I did go to a bar and I didn't wear a mask and I shared drinks, and now I understand this wasn't a good thing. I ended up in the hospital. Could you help me? And it's like, you know, didn't touch my heartstrings. So the take-home points are, most of my patients, or all of them, are really in much better shape. And I do like to make the point, for a lot of people, I've had some patients who haven't left the house in 4 months, and I don't think that's a great idea, because most doctors don't see an end to this till next summer. And who knows what we'll be saying next summer. Is a vaccine is iffy, a safe vaccine may be even more iffy, and we don't. So there are a whole lot of unknowns, and I think big companies like Google are saying everyone can work from home till next June. Nobody is rushing to get back into a normal situation, which means you probably better find a mask you like and learn to use it. And you're also going to still need to get out and do reasonable medical care. And that's what some of the biggest things I see going on, is people not doing reasonable medical care, which would be keeping up with dental, keeping up with cardiologists. If you have a chronic condition, seeing the doctors. And so I wanted to talk a little bit about just what masks are reasonable, how does transmission happen? And I don't have pictures of the masks or the statistics. The mask doctors are wearing is an N95. If you've tried one, because you can buy one, or if you wear one, you know they're very difficult to breathe in. And if you're wearing one that has a respirator, it may be helpful for you, but does it means if you're infected and you're breathing out your respirator, you can still infect somebody. So you need to wear the ones without respirators. And again, I think we all know what it's like to wear an N95 in 110-degree temperature, walking across a parking lot carrying some groceries. It doesn't work. And it's not necessarily necessary. All these statistics have happened in Arizona with people wearing everything. I don't really recommend bandanas or the things you just pull up over your face. The second safest are the surgical masks, the blue things you see everyone wearing. Those are probably the best for most people. You get one day's use out of them, and then they're probably not as effective. But that's what I wear. I'm just going to tell you what I wear and throw out after a day is a blue mask. The cotton masks, if they're 3-ply, can be very effective. Again, you have a breathing issue with some of them. And for others, it's just the idea that you're going to now be adding washing masks every night to your list of all the things you do in life. That makes it hard sometimes to do more of the homemade masks, but they can be effective also. The best combination for most people, if you're going to a doctor's office, you want to feel safe, but you want to still be breathing while you're in there, would be a blue mask, a surgical mask, and a face shield. That's really pretty reasonable. It's covering your eyes. You're getting really pretty good protection. And the idea is not to sit in a waiting room for an hour. Is less than 20 minutes at 6 feet is really going to be a very safe zone. There's always going to be a little risk. You're always going to hear the story of somebody who touched one Amazon package and got it. It's touching packages, what we call fomites, is a really low risk activity. So it's high risk to avoid medical care too. So you have to make decisions and have to learn in some way to make some peace with all of this, and that's going to be different for everybody. But I urge you to reconsider if you've been staying in completely and avoiding medical care at all. People are getting body work, going to chiropractors, getting physical therapy. You can ask your doctor. You have certainly every right to ask your doctor, what are they doing to disinfect? How are they handling it? If you go to one of our dentists, Dr. Krisman, I think her office might be safer than my own home. The protocols she's running are very safe and tense. And I felt very safe there. I contacted another doctor who I've seen. They weren't wearing a mask, and it was just like, I have no idea what they're thinking. I'm not going in that practice. So you make your own decisions, but I'm trying to tell you what the science is here with all of this. And I do point out, you see people wearing just face shields that came out recently. They don't do much. They don't do anything really, because it can, with normal face shields, get in around the side and underneath. And one study in Switzerland showed the waiters wearing face masks were the only people who got infected, and they seemed to have worse infections than they would have had normally. So this is a safe face shield. If you have reasons for not wearing masks, and there are legitimate PTSD reasons, and I think those are the most legitimate in terms of things you can figure out why having something covering your mouth is very hard, is wearing a face shield with this kind of draping is a reasonable compromise. Basically, you kind of have a balloon around your whole face. And you can buy these, you can buy everything pretty much on Amazon now. So the other point I wanted to simply make is that you really need to have a pulse oximeter. I'm surprised. I know I've made this point, I've told people, and people still will say to me, what is a pulse oximeter? This is one, you get it, your doctor, most doctors' offices will measure this, and you put your finger in, press this, and you're going to saturation and a heart rate. You can get them on Amazon, most drugstores, about $30 to $80. The reason you want it is that this is what measures your saturation, and it's probably the most important measure about how you're doing. if you should be running 97 to 99, even if you have chronic fatigue, most people. And so getting one, knowing exactly where you are you 96, are you 99, helps you follow the progress if you think you have COVID. If you're running 98, 99, if you have COVID, it's certainly not a serious case of COVID. If it starts getting below 95, you need to have made contact with your primary care, and most of them are advising you to be in a hospital by the time it gets down to 92 or 91. So it is a really important piece of equipment to have and to learn to use it. This is one more expensive, but you may want to consider. I've recommended it to some patients who love it. It goes around your thumb. You can get it on Amazon. It's made by a company called Wellue, W-E-L-L-U-E. And it hooks up to an app, which is nice. And you can wear this at night and use it also to measure your saturations at night. And that's a nice thing. You can actually begin to see, do you have sleep apnea? Some people are surprised their oxygens will drop below 90 multiple times during the night, and that's not a good thing. The app will tell you that, and it also has a little buzzer that wakes you, which is supposed to remind you to get on your side. And on your side, most people will breathe okay. So it's going to be about 180 on Amazon. But for the people I've recommended who we think might have sleep apnea or have more serious oxygen problems, we're thinking about an oxygen concentrator. This is really a good investment. And if you have a partner who snores, great investment if you're trying to convince them that there's an issue going on and they don't feel there is. So this is just a more expensive pulse oximeter that will give you a reading for 8 hours. And that really is my update. The things that I recommend besides the pulse oximeter is when we talked in March, the understanding was it affected your lungs. That's where the major damage is. That's not quite true. It turns out the lungs are essentially just a portal to the rest of the body for this virus. And a lot of the major damage that's been done is actually through microcoagulation throughout the kidneys. The heart would be major organs besides the lungs, the legs. And the coagulation can be surprising. It can appear in what appear to be otherwise very healthy people. And a recommendation many traditional doctors are making, besides integrative doctors, is to be taking at least a baby aspirin every day. If you don't have a contraindication for that, like being on another blood thinner, don't add the aspirin. Or if you have some sort of severe GI distress, not a great idea. Otherwise, I would recommend doing a baby aspirin or using nattokinase, a more natural anticoagulant, which may work better for some people. These things are all very useful, very reasonable to add to other recommendations I've made previously. Otherwise, our understanding is growing of COVID, what it does through the coagulation. The highest risk factors are not the lung patients and heart patients, what we thought they would be, certainly not the mold patients. The highest risk factors really that are coming out in the most recent study is morbid obesity. Highest risk factor in the latest study is, I think it's a BMI greater than 40 is by far, it seems, the greatest risk factor for having severe complications. Diabetes is another severe one, but even diabetes doesn't come close to just the severe overweight. And that might be why my population is not seeing such dramatic effects from it, is in everybody, we're always working with diet, and we're working with something we call free radicals, reactive oxygen species, using antioxidants, trying to decrease metabolic changes like your hemoglobin A1C and getting them down to good numbers. So I have heard a lot of people tell me about their COVID pounds as if they don't count. Some may be okay. but you really don't want to carry it away. It's as important as all the supplements you're taking to be in pretty good shape metabolically. And I think that's really the latest of updates. I can stop what I've been saying now and take a few questions and just make it brief, that of anything that I can answer for you about what I just said or other questions you have.
Dr. Mary, do you want people to type their questions in the chat or say them out loud, or either way?
I can look at the chat if you've already put some in there. As soon as I find it here on my screen, which have participants.
No one's asked a question in the chat yet, but someone did ask a question who couldn't be here. They asked about zinc supplementation. Do you recommend zinc?
Absolutely. That was in my first time I made series, and nothing has changed there. Is you want to be taking zinc. You want to have had your zinc levels measured recently. You want to be normal. If you think you have COVID, you would probably want to double the amount of zinc you're taking, at least for a few days. And that probably brings me into the question somebody's going to ask, and we might as well talk about it, is, well, aren't you supposed to be using hydroxychloroquine with that zinc? To get that zinc, it's used to get the zinc evidently into the cells. I think this is the most, it's hard to describe as a doctor watching politicians micromanage medical care, from masks to quarantines to social distancing to medicine. So hydroxychloroquine initially seemed to be useful. It seemed to be useful in China. In the US, it became immediately a political issue. A number of governors told their constituents that doctors would lose their licenses essentially if they prescribed it for COVID. And that put a real crimp on most doctors using it. Studies have come out in the US which are very mixed. And the way you interpret it, in medicine, that's always the way it happens, okay? We have a lot of mixed studies. You have to know what you're looking at. It's useful. If it is useful, it's useful early in the disease. So for some reason, most of the studies were done late in the disease where people were about to die anyway, and they said, oh, it's not effective. Some of the early studies show that it does show mixed effectiveness. And so it's an open bag. It's probably, a recent poll showed around the world, 37% of doctors find it useful. They're using it a lot in Spain and India. In Ohio today, someone sent me that after we all saw the protests on the Supreme Court of doctors saying how incredibly useful it was, Ohio suddenly dropped its restriction that it was going to take away licenses if you prescribed hydroxychloroquine just today, and said, doctors, it's okay to prescribe it. Okay, you know, that's not the way medicine really runs, based on protests of people saying things. If you ask me about it, I would say it's probably useful. It's not a miracle. And that's really pretty much what studies are showing, but the studies are all, again, depends whether you're basically Republican or Democrat, it seems, how you interpret the studies and what the mix is. So that's the story on hydroxychloroquine. It's kind of fascinating if it wasn't a living science experiment we are all involved in at this moment. Okay. Next question.
Next question in the chat is, what is the difference between being exposed to a small amount of virus versus a large amount? Doesn't it just take one virus particle to start up the illness?
No. It very clearly is a dosage effect. So doctors working in hospitals doing trachs, high rate of getting it. Also ophthalmologists, because the eyes are such a route of entry too. We're very high rates in New York. Getting a small amount, I mean, no one knows how small before you then get it, but small amounts for short periods of time are clearly much less of an issue than larger amounts, someone coughing in your face and having it go on, like sitting in a waiting room where someone is coughing the whole time, or in an office, someone's coughing at the desk next to you, much higher risk. than passing somebody as you're walking by and they coughed and you're going the other way. So dosage is very much part of this, all of it.
The next question is, what are your thoughts on the Buhner Pan tinctures from Woodland Essence?
I love them. In people who've used them, and realize I've only had one test positive, I probably had about 50 people who think they've had it and have tested negative or didn't get a test at all. So my feeling, and a number of these people have used the tinctures and just felt that whatever they had, that they felt much better, that it seemed to help them sweat, it seemed to help them breathe better, their blood pressure went down. So I am a big fan of using some of them preventively. And by preventively, I do not mean that it means you're not going to get a virus. It means that if you've had an exposure, your body can either handle it and you don't get it, you're asymptomatic, or you get mild symptoms. That's really what we're aiming for. I don't know of anything magical except never going out anymore for for a very long time to absolutely prevent the virus. So yes, I like them. And I think red sage, bacal, and kudzu would be my favorite prophylactically. It gets your body in a much less inflamed state and helps the coagulation, most likely an inflammation that would make things worse.
Thank you. The next question is, how many strains of the virus are there? And if there are different ones, are some worse than others?
There's supposedly two, the China and the European ones, LNS forms. And I think most of the US has the worst one. I haven't heard much about it in the last month. You can look at death rates and differences. I'm not sure if it's going to be strains or just New York has a much higher death rate overall than, say, Arizona does. And I think it's because they were caught more unaware, less prepared, and we really didn't know how to do anything. And now we have some better tactics. We don't put people on vents right away. We're using steroids in the beginning, and people seem to be surviving much better. So there is, I think actually there have been 38 different types overall, but two major ones, LNS.
Thank you. The next question, do you suggest we check copper levels along with zinc levels and or take copper to balance out zinc if zinc is too high?
I suggest taking some copper, no more than 2 milligrams a day. That's the normal intake, and that's enough to balance. I try and measure copper on most people, especially if zinc is low. If zinc is normal, I'm probably not going to measure copper, but I recommend it, and I've always recommended people be on some sort of a multivitamin that includes a daily minimum count of copper.
Next question is, what causes an extremely high zearalenone? I'm going to type it in the chat again because I'm probably not saying it right.
Oh, well, that would be a mycotoxin and really is not our COVID test. It's, I believe it's really with Stachybotrys, but again, that's not COVID and would be a urinary mycotoxin test.
Next question is, please address children going back to school.
Oh boy. I feel like Arizona just passed its first exam here. We clearly had our first wave. We peaked, we flattened. It's been, if you looked at this or if you knew about it, if you knew doctors in the hospitals, it's been kind of scary. And we're in a better place where we have been flattening. Our death rate still needs to come down. I don't feel particularly safe. I don't think this is over. And you hear a lot about, do children transmit? Do they not transmit? What about teachers? There's so much controversy. I think if schools reopen, they have to be done in small groups for younger kids. And probably it is possible, probably going to end up seeing everything closed down fast, is my guess. U of A, I'm not sure where they are right now. They were going to fully reopen. Now most colleges have plans where small little pods are going to mingle together and still pay full fare. And I am somewhat worried that have the least amount of people in Arizona in July for obvious reasons. And U of A is what, 30, 40,000 people if they're all coming back, and the snowbirds coming back. I'm pretty sure that's going to be another peak. So that, and some universities are not opening at all. Others appear to be opening fully, nothing online. I think we're going to see very quickly how that works. So you asked me a long question. Again, it's a science experiment. If you feel your child is not safe or what might transmit to people who really could not afford to get the virus, probably not the best idea to be doing it, or you want to be doing it in a small group with people you really trust to continue to maintain good practices.
The next question is, do you know the percent of false negative COVID-19 results?
It's 30%, or it was 30% for the PCR test, which is the test that counts. It's the one where they basically do a mark-ons. They go way back and test you, and it was 30%. The antibody test, the serology, is like 99%, the Quest and LabCorp ones. If you're negative on the Quest or LabCorp, you didn't have it. However, those antibodies, it looks like, can fade after 3 to 4 months. So if you thought you had it in February and you're testing now in July, it could be fading too, but they are very sensitive.
What do you think about using copper to swab the nostrils daily?
You don't want too much copper. If I were going to, I think silver would be safe. Iodine is actually okay. Copper is mixed blessings. You can get too much copper, and that's not what I would be using. I would just be using, you're wearing a mask, and remember, the correct way to wear a mask is over your nose, okay? Wearing it under your nose doesn't count. Wearing it under your mouth really doesn't count. And you see all of that there. I'm wearing a mask, no one's gonna bother me. Really needs to be covering the nose. So therefore, why would you wash your nose? You should not be getting anything into it. I know I still do when I get home, but logically, it doesn't make a lot of sense that I am. None of us are totally logical about all of this. I'm telling you, my quirks is what I do. Because I do go out, I see my own chiropractor like every other week. I've gotten my hair cut, obviously, and will again. Alex has seen a body worker. I've seen my dentist. I've seen my eye doctor. And when I wear a mask, I've worn a face shield in one situation and a mask too. When I get home, I tend to just take off my clothing, take a shower, and put on new stuff. And again, not totally necessary. I feel better, and that counts, okay? That counts too, as you feel better. And I've felt pretty safe. I don't think I could continue working like this and doing things if I wasn't doing some self-care too.
We have one more question here. It's somewhat of a question. As soon as school starts, the ER gets quite busy and stays that way with the flu, colds, viruses, strep. You name it, kids under 10 spread diseases 10 to 100 times faster than adults. Why the study?
What's the question?
Debbie, you're muted.
Dr. Ackerley, as an ER charge nurse pediatrics for years, I can tell you, as soon as school starts, the little petri dishes come in and they just spread everything so quick. And so why would this COVID virus be any different than anything else that they spread? And why the study? I don't understand why they keep on talking, Redfield and Burke's talk about, well, we need to study to see if these young kids will spread it. I'm telling you, they will, period. And I called the CDC on this too and told them, to pass the information on to the Redfield and Berks. You just need to talk to those ER nurses, that's all.
Right, and that's true. Most of us think we're going to see less flu this year because people are wearing masks, including children. And children as young as 3 can wear masks and maybe younger. So if children are really wearing masks, maybe there'll be less. But, you know, I think most people agree with you that keeping young children socially distancing and wearing masks is going to be a very difficult task.
Then be able to monitor them washing their hands. They got a runny nose and it's on their hands and it's just, you know, they just spread it everywhere. I'm sorry.
That's common sense. It was kind of what I said when I heard you don't need to wear masks. It's like that makes no sense to me whatsoever.
Amen.
Again, it's a living science experiment. Every state gets to set this. In Arizona, we didn't ever do a strict lockdown. We really didn't, not compared to what people did in California, where they really stayed inside. They really wore masks outside. Essential workers really didn't mean real estate, where they have been here. And yet we didn't seem to do that much worse than California until we just actually opened up the bars and the gyms and allowed really close contact with heavy breathing. I think that's been a really high risk. And that's, again, it's a living science experiment. What works? Did lockdown, was it really necessary? Did it work? Do masks really work? I've tried to show you this graph. It's my belief masks and distancing do have a big effect. If you can make school kids do this, or adolescents, or even college kids, quite frankly, that's another science experiment in behavior. So I am a little worried about Arizona and Tucson as we begin to open schools, have an influx back here.
We have a few more questions popping up. What do you suggest to the dentist in terms of precaution before and after?
If you go to Dr. Chrisman, she made me take off my own gloves. I said, I just put on these gloves. I just walked from my car here, but nope, you got to take them off. We have to see you wash your hands and put on yours. And I was like, okay, and washed them. And they went to the other buildings. They wouldn't even let me go get my own gloves. They went and got their large gloves. And at that point, I realized they're running the show. She's running ozone cleaners at night. She's running cleaners all day. She's wearing a double mask. I don't know how the poor lady talks through that thing. And as I say, I really did feel safer there. They knew what they were doing. I've been in other institutions where, you know, the mask is like, yeah, you should wear a mask, and you're not watching anyone really, you don't smell hand sanitizer. I don't feel nearly as safe. I felt very safe there. You need to make sure where you're going that that's what's being done. And if you don't feel safe, leave. But there are a number of doctors who are being reasonable in what they're doing. And so that's just what I've watched her do.
Speaking of reasonable doctors, someone asks, I miss in-person visits with you. What is
I've heard that a lot. And honestly, I think if I've had, you know, if I've had appointments with you where things have crackled, the audio hasn't worked, this is really working well, it is not a lot of fun for me to be running a TV studio at my, you know, office table here with lights and screens, and Alex has fixed it up, and, you know, you can't get Comcast to come in, so I had to install my own modem this week because the modem supposedly broke. You know, it's not a lot of fun. It's not really medicine running this, but I think in terms of safety that I can't feel really comfortable sitting for 2 hours or talking to people in mass with people coming in wearing stuff until we have a much better idea of control. And I don't see any reason to. I think if you're doing things physically, a chiropractor can't do what they do. A hair cutter can't do what they do online, and dentists can't either. So it does cut down risk a lot for everybody, but it was much easier when I just saw people in person. It really was easier technically, and I could just listen to what you're saying instead of wondering about your bandwidth and data latency issues as well as mine. So this is where we are. Arizona has come through, I mean, to have the highest, second highest, Louisiana is the only one highest, and they started back at Mardi Gras with their problems to be the second highest infection rate in the country, is pretty amazing that, again, everyone here as well, everyone I've seen, I just haven't had anyone tell me they've been hospitalized. And certainly I haven't heard of any deaths. So we're all doing something right here, just not sure which one it is. And that is of reminders, keep up doing stuff. There's a fatigue that comes with all of this. During the COVID fire, during the Bighorn fire, I remember rushing down to the embassy suites to get a room before everyone else was getting it. And I ran into the hotel. I didn't put on the mask and gloves. They were right there because on my mind was just, you know, get a room, is my house burning, etc. There's just fatigue. You can't worry about everything at once. But try and keep taking supplements, you know, try and keep working the masks, and don't give up, because on the whole, a lot of people I work with are healthier than they were in March, which is really interesting that given time to focus on themselves and given the time to not have to run everywhere and do so many things, there's more energy, more focus, and a little more compliance, and people are healthy and will tell you they feel better overall. So hopefully this has helped just get people, it's like, here we are in the middle of it and we're living with it, and you need to continue being protective, but balancing risks. The immediate solution of locking down and not going out just isn't going to hold through, you know, another year of this at least.
Thank you, Dr. Mary. You have more questions in the chat, but I know we want to honor your time. So if you want to, just let me know what you want to do.
Is regular hand sanitizer safe for toxic patients? Again, I'll just tell you what I do. Is I wear the blue gloves, the latex-free ones. So does Alex, simply because hand sanitizer does rub away a part of your skin barrier if you keep using it. My skin's sensitive enough, it's just easier to wear gloves. And when I wear gloves, I'm very unlikely, I remember wearing gloves. So there are organic ones that smell good that might not feel quite as toxic. But gloves are really better for the skin, I think. And remdesivir seems helpful. I can't tell you, there's nothing here that's a takeaway miracle. It seems helpful in decreasing IL-6, but so is curcumin and low-dose naltrexone helpful in decreasing IL-6 too, if you're not in a hospital. If you're in a hospital, it's a different deal. So, oh, and one more thing is not everything is COVID. I had one patient, I was convinced, and a primary care doctor was convinced, we were all convinced, because she had a fever, cough, malaise, that she had COVID. She, on the other hand, had been to a groundbreaking ceremony of her new home and had read about valley fever and kept saying, do you think I had valley fever? The people who've trained here in Arizona, who've grown up, it's like, absolutely not, this is COVID. I was like, I really think this is COVID. We got the test. She had valley fever. She didn't have COVID. So it's not all COVID. If you're running a fever, do ask for the valley fever test. We had a wet winter here. The spores are germinating, and she was right by a bulldozer breaking up the ground for her new home. So it was a classic situation, but I don't think most of us knew it could present with such, you know, a high fever and cough that fast. It was with, you know, in a few days afterwards. So remember that valley fever is real and another risk and can look like COVID. And nobody will really believe you have it and keep insisting to at least get the test too. Okay, so I'm going to stop the recording. Hopefully we have a recording. Let me just find that and then let you continue on. And I'm pausing the share. And you know something? Okay, so I stopped the share. I think, oh no, I could. I did. This is 4 or 5 months into this, I did actually remember to record